Thank you, JB.
You're welcome. Thanks to everyone who has joined us so far. We're just waiting on a couple more of our panelists to join. We'll get started shortly. Looks like we've got Dr. Morrow. Can we do a quick audio test for you, Dr. Morrow?
Yeah, hi. Can you hear me okay?
Sure can.
Sure can.
Looks like we're just waiting on our final panelist. and we'll be ready to go. Okay, and it looks like we have Dr. Anderson now. Dr. Anderson, I have made you a panelist. If you can just check our audio real quick, then we'll go ahead and get started.
How well can you hear me?
Sure can. Okay, great. Thank you everyone for joining us. We have 3 panelists here today to give you an update on the COVID-19 outbreak at St. Michael Medical Center. Each of our panelists will share a brief update on their efforts, and then we'll move to our Q&A. So our panelists today are Dr. Gib Morrow, Health Officer at the Kitsap Public Health District, Rear Admiral Michael H. Anderson, MD, who is the Chief Medical Officer for CHI Franciscan, and Dr. Scott Lindquist, the State Epidemiologist for Communicable Diseases at the Washington State Department of Health. For our Q&A, as mentioned in the advisory, we will call on and unmute individual reporters who have submitted a request to ask a question. We may not be able to get to everyone who has submitted a request, but we will get to as many as we can. So I am going to go ahead and turn it over to Dr. Morrow to begin.
Yeah, hi everyone. Can you hear me okay?
We can.
Okay. Well, thanks for joining. We're providing an update on the outbreak at St. Michael Medical Center in Bremerton. We want to thank our Kitsap Public Health employees, St. Michael staff, and the Department of Health for the hard work and cooperation to address what's a very serious situation for the hospital and this community. We know this outbreak is very concerning for Kitsap residents, and we want to assure our community we're doing everything in our power to prevent additional illnesses. Our hearts go out to the essential frontline healthcare workers and their families and all the affected patients who've been directly impacted. The current situation as of noon today is that we've identified 45 cases linked to this hospital outbreak, 30 of whom are staff and 15 are patients. We expect this count's going to grow as the hospital continues comprehensive testing of staff and patients. Kitsap Public Health continues to investigate cases and is working as quickly as possible to notify close contacts. The hospital has been notifying patients discharged from all the affected units, and we've made a number of specific recommendations to the hospital in consultation with the Department of Health and with CDC to help prevent additional cases. And these include comprehensive testing of all staff and patients, enhanced symptom screening for staff, restrictions on visitation of the hospital, limiting movement between the units of the hospital, and the hospital's instituted some additional measures that they are likely to address. The timeline is that the initial case at St. Michael was reported to the health department on August 4th. Our investigation of that case at the time did not reveal any close contacts at the hospital. On August 13th, based on case investigation, the health department identified 5 cases linked to the initial case in 1 unit at the hospital, and we subsequently declared an outbreak and recommended the hospital begins systematic testing of all staff and patients in that unit. Testing from that revealed additional cases. We recommended testing in other units last week, bringing us to where we are today. We posted a more detailed timeline on the website and plan to update case counts daily moving ahead. Outbreaks like this are a reminder for people to stay home and get tested if there are any symptoms, no matter how. With that, I'll turn it over to the next speaker.
Great. Thank you, Dr. Morrow. We are going to go to Dr. Anderson next.
So this is Dr. Mike Anderson. I'm the Chief Medical Officer for CHI Franciscan. I thank Dr. Morrow and Dr. Scott Lindquist for their partnership in this endeavor as we try to contain this incident of outbreak at St. Michael Medical Center. Just want to remind everyone, St. Michael is a medical center located in the Kitsap Peninsula, and because of that, not only do we serve those in the community around us, but those dedicated employees that have been working tirelessly since the outbreak of COVID-19 throughout this country have diligently and courageously worked through the pandemic such that they hope to avoid any incident like this. But now that we are challenged with this, they continue to work tirelessly to, like I said, contain this outbreak. So with the identification of first a staff member that contracted the COVID-19, I'll have to say that the medical center has taken several steps. Probably most important of all the steps was to identify the issue, but also to contact the Kitsap Public Health and start our partnership so that we could work shoulder to shoulder with this, and certainly as well work with the Department of Health. At the same time, just want to emphasize throughout the pandemic, the staff at St. Michael Medical Center has used and abided by the recommendations of the CDC to include the level of PPE or personal protective equipment that we use, and certainly with other recommendations such as visitor limitations with that. At the first sign of this outbreak, certainly we had to roll back some of the limitations, or actually we returned to some of the limitations that we initially put in place with the outbreak of COVID-19 within the Puget Sound, specifically things like visitors. And we understand how important it is for family members to be able to see their loved ones who are in the hospital sick. But because of this outbreak, we've had to return to a very limited opportunity for visitors to come to the hospital. So limited that we limited to 1 visitor for end-of-life events in which we know that a patient is terminally ill, and we allow 1 visitor to come at that time. We also limit our visitors to those that are coming to pick up a patient to return them home, specifically if they need to be educated on care of the patients that they're taking home with them, or in a post-operative condition to monitor them with that. In addition, we have also expanded our testing of both staff and patients within the facility. So earlier along in the pandemic, we started to test every single patient that was admitted to the hospital, not only for elective surgeries, but also for patients coming in for conditions that may not have even been related to COVID-19. So at the time of the outbreak, we had already tested the patients, and that's how we were able to determine that patients did not necessarily arrive infected with the virus. At this time, we've also increased the number of contact tracing, and I'll have to say this is one area in which I have seen the staff really work hard to cover every bit of territory that needs to be covered, specifically spending long hours calling individuals that were potentially exposed, and then evaluating the circumstances in which they were exposed if there was evidence of exposure. In addition, we tested all those that were concerned about exposure, and obviously that's how we were able to determine that there were 30 staff members that were positive after this. We continue to diligently look after this aspect, and we'll be testing every single member of the hospital staff as well as the medical staff over the next couple of days. We also have made sure that we've increased some of the protections above and beyond what the CDC originally recommended for high-risk procedures, in that we're now elevating our posture until we know that this outbreak has been contained. We are also planning to retest patients on the units that were known to have an increased incidence of COVID-19 unexpectedly. We are planning to continue to monitor those patients on a regular basis to ensure that any further spread has been halted. We also want to echo the public health guidance that wearing masks are extremely important, not just in the facilities. For those of you that may have visited St. Michael Medical Center, you know that we have required universal masking of all our visitors and staff throughout the facility. In addition, just want to stress the importance of hand washing and limiting the interactions with individuals or social distancing when talking to folks, and size of gatherings. We are committed to working with the State Department of Health as well as Public Health until we can show that this outbreak has been completely resolved, and resuming our posture of constant surveillance for additional unexpected cases. With that, I'll pass it on, I guess, to Dr. Lindquist.
Thanks, Dr. Anderson. Dr. Lindquist, it's all you.
Okay. Hi, welcome everybody. It's unfortunate circumstances, but Department of Health is here to help find a resolution to this unfortunate outbreak in a healthcare situation. Usually when these happen, the hospital recognizes it, contacts their local health jurisdiction, which did occur. They certainly let their licensing board know that this is going on, which they did. And appropriately, the local health jurisdiction instituted some recommendations. They actually reached out again to us at Department of Health for additional recommendations as this progressed on. We did have a consultation with the CDC and the hospital and the local health jurisdiction. And currently, these recommendations that Dr. Anderson just talked about are recommendations that we agree with at the State Department of Health. And again, outbreaks in healthcare associated circumstances are unfortunate events, but this is not the first hospital to have one of these outbreaks. And we feel confident that we'll be able to help them control this. We are here to support the local health jurisdiction as well as the hospital system with any resources that are needed. And with that, I turn that back over to you, Kirsten.
Okay, great. We are going to go ahead and get started on Q&A. And our first question is going to come from Ryan at the Seattle Times. Ryan, you are unmuted.
Hi. Are we going to have a chance for a follow-up question like in the
yes,
state
you will.
briefing? Okay, great. Thank you. So why was notification only for those patients who are in affected units and not patients and family and friends who had visited any time during this outbreak, considering it seems to have moved so quickly through the hospital? I'm curious as to why only notifying the people who were in the units where it had showed up.
So this is Dr. Anderson. I hope the question was directed my direction, but I'll have to say that there has been an incredible amount of work for contact tracing, and indeed, part of that effort was contacting those that may have been on the affected ward. So realistically, with the resources that we've been allocating towards this, we try to do what contact that would basically have the biggest bang for our buck. So we start from the center and then work on out from there. And even this press conference is one of the means we're using to notify others that may have been affected by this.
Dr. Anderson. Ryan, did you have a follow-up?
Yeah, I did. And then when the staff, medical staff and support staff and whatnot were tested, were they told to keep working even if they weren't showing symptoms between the time they were tested and the time they got results?
Very specifically, we followed the CDC guidance as far as evaluating the level of risk that any exposure might have. So even though we may have offered testing to an individual, if after the contact tracing and evaluating their exposure risk, they may not have fallen into a category that said that they weren't eligible to come and work. So I would have to assess each of those on a case-by-case basis.
All right. Thanks, Dr. Anderson. Our next question is from Keith at Como. Keith, you're unmuted.
That's for Dr. Anderson. So this was traced to one staff member. Is that the leading cause of this, one staff member? And is the hospital open for new patients, or do you have to lock down until this is cleared?
So to answer the question about new admissions, I will say on the affected units, we have not been admitting patients to those units for the last week. The hospital is still evaluating and assessing patients. And to make it perfectly clear, St. Michael Medical Center actually has two campuses. We are talking about the Bremerton campus currently. They also have a Silverdale campus, which is approximately 8 miles away from the Bremerton campus. In regard to the index case, I'll have to say that due to our ongoing surveillance, which includes daily questionnaires for every staff member, it became apparent that a staff member indicated that they were not feeling well and they had symptoms that were consistent with an influenza-like illness. And at that point, further investigation was performed to include obtaining the PCR test for COVID-19. It was at that point that we recognized that the staff member was ill with COVID-19 and the contact tracing started. And of course, with the staff member providing direct frontline care, then that contact tracing involves testing patients as well.
And just to make clear.
Keith, did you have a follow-up?
Yeah. And just to make clear, so it is traced to one staff member, and that staff member spread it now to 45 people.
Well, when we talk about contact tracing, there's always going to be multiple variables to this. You would hope that it would be as clean as that, but of course, as we start to do more and more investigation, and this is where Dr. Lindquist, as an epidemiologist, can say there are always going to be circumstances in which you say, well, you need to be tested and the test turns out to be positive, and then there's multiple potential sources for that contact. So I'm never going to say 100%, but the testing that we've done so far has been a result of the contact tracing.
All right, our next question is from Austin at the Kitsap Sun. Austin, you're unmuted.
Yeah, in the initial statement last Friday, you had said, state health officials had said that multiple units had been affected in the hospital. I'm curious what units had been affected, which ones have been shut down, and where patients from those units have been going since then.
So there are 3 units, and to be absolutely truthful, I do not know the unit numbers of those 3 units. Although we have not been accepting admissions to those units, the patients that were on those units have remained on the unit. So we continue to provide care on those units, obviously with close screening, and as I mentioned before, with plans to do repetitive screening of those patients on the units and of the staff members.
Austin, did you have a follow-up?
So just to make sure, right, basically patients who were already in those units have been kept there and there's been ongoing testing for them and staff. They haven't been moved, though. No new patients have gone into those units.
Correct.
Okay.
Okay, our next question is from Anna at KOW. Anna, you are unmuted.
Thank you. Question for Dr. Lindquist. Looking at the index case, how were they originally exposed to the virus?
Yeah, so quite frankly, Anna, that's not a good term, calling something an index case with exactly these things that Dr. Anderson talked about. There's so much community exposure right now. We know that our biggest exposure risks in the community are restaurants and bars and public gatherings. So, you know, I think Dr. Anderson's right. While they screened this employee and they were the first one they knew about, there are so many other potential community exposures that I wouldn't be comfortable as a state epidemiologist saying that that was the only exposure in the hospital. There was so much community exposure going on in the Puget Sound area at the same time that it could have been any of those possibilities.
And follow-up question. Dr. Morrow, you mentioned that you made some recommendations to the hospital. What lapses in the hospital's infection control procedures facilitated such an outbreak and led to your recommendations?
You know, I think this is just an example of how insidious and tricky and difficult to recognize this virus is. And that's the reason that every one of us needs to behave as if we are infected and everyone around us is. You know, the state is coming in tomorrow to do an on-site visit to the hospital. It's really not our regulatory role to regulate the hospital. We do case and contact investigations, and we're focused on controlling this outbreak and preventing more issues. So we did make a series of recommendations, but have not fully evaluated hospital processes.
So can I just add to that? I think Dr. Morrow is right here that the next best step is to bring in a healthcare associated infections team to really look at the process to see if there are any problems. I think, you know, Dr. Anderson and Dr. Morrow are asking for this evaluation, so we'll come in very objectively and give them any feedback we can, seeing their current circumstances. We do learn lessons from every healthcare associated infection, and a lot of those recommendations were based upon our history with similar circumstances across Washington State.
All right. Thank you all. That is the end of our folks who have requested a question. So we will go ahead and close out for the afternoon. If you still have questions, you can reach out to us at each of the following contact emails. For public health questions, you can reach Kitsap Public Health District, the lead on the epidemiological investigation, at pio@kitsappublichealth.org. You can reach the Washington State Department of Health at doh-pio@doh.wa.gov. And you can reach CHI Franciscan at chimedia@quinnthomas.com. Thank you all for joining us, and we look forward to speaking with you next time.
Thank you.